Hey everyone, and welcome back to KenkoVibe, your daily dose of health insights. I'm Ethan Reed.
And I'm Grace Morgan.
Always a pleasure to have you here.
Thanks for having me back.
So today we're going to be diving into a topic that might make some people squirm just a little bit.
Yeah.
Male yeast infections.
Ooh, yeah.
You heard that right, guys. It's not just a women's issue, as some might believe.
That's right. We are here to kind of break down that stigma and really dive deep into the science and the symptoms and potential complications of these often overlooked infections.
Yeah, overlooked is, I think, a good word for it.
Yeah.
For those who might not know this is a thing, what exactly a male yeast infection? What's going on down there?
So the medical term is candidal balanitis, and it's essentially a fungal infection that occurs on the penis, and the main culprit is candida, a type of yeast that normally exists in our bodies in check, but sometimes things get a little out of whack.
Out of whack? How so? We all have this yeast hanging around. What makes it go rogue?
You can kind of think of it as like a delicate ecosystem. Candida is usually kept in check by our body's natural defenses, but certain conditions can tip the scales in its favor. And those are things like a weakened immune system, certain medications, even tight clothing or poor hygiene can create a really perfect environment for Candida to flourish.
So it's like creating a tropical paradise for yeast.
Exactly. Warm, moist, and lacking those good bacteria that usually keep Candida at bay. It's just a recipe for an overgrowth. And that's when the trouble starts.
Okay, so let's talk about that trouble. What kind of symptoms are we talking about here? How would a guy even know if he had one?
Well, there are a few telltale signs. One of the most common is redness and irritation around the head of the penis. You might also notice a rash, itching, or even some unusual discharge.
Discharge? What kind of discharge?
It can vary, but often it's described as thick, white, and sometimes even clumpy. Definitely not something you want to ignore. And in some cases, there might even be a bit of a yeasty odor.
Okay, that's not painting a pretty picture.
Definitely not a highlight reel moment. And the symptoms can go beyond just the physical discomfort. Some men experience pain during urination or even during sex.
Okay, now that's definitely a sign something's not right.
Right. And this is where it gets even trickier. These symptoms can sometimes mimic other conditions, including some STIs. So self-diagnosing is a big no-no. If you are experiencing any of these symptoms, seeing a doctor is crucial to get the right diagnosis and treatment.
So what you're saying is don't try to be your own doctor.
Exactly. There's a lot at stake, and getting the wrong treatment can make things worse or even delay the healing process.
Okay, that makes sense. So let's say you go to the doctor and they diagnose you with a yeast infection. What are the treatment options? Is it a simple fix?
Well, the good news is that most cases are relatively easy to treat, especially if they're caught early. In mild cases, sometimes improving hygiene and making some lifestyle changes can be enough.
So back to basics. Soap and water. Fresh underwear.
Pretty much. Keeping the area clean and dry can make a big difference. But for more moderate to severe cases, doctors will usually prescribe an antifungal cream or ointment that's applied directly to the affected area.
I'm talking topical treatments.
Exactly. And these are often very effective in clearing up the infection.
Okay, so that's reassuring.
Yeah.
But what if the creams don't work? Are there other options?
In rare cases, especially if the infection is severe or keeps coming back, your doctor might prescribe oral antifungal medications. These are usually taken for a short period and can be very effective.
Got it. So it sounds like there's a range of treatment options and doctors will kind of tailor the approach based on the severity and individual circumstances.
Exactly. It's about finding what works best for each person and addressing not just the symptoms, but also any underlying factors that might be contributing to the infection.
Okay, that makes sense. But let's get to the elephant in the room, or should I say the yeast in the pants. This whole thing about male yeast infections potentially causing erectile dysfunction. Is there really a connection?
That's the million-dollar question, isn't it? And it's one that we hear a lot. While the research is still ongoing, there are experts who believe there could be a link, though it's not always a direct cause and effect relationship.
Okay, so walk me through this. How could a yeast infection actually lead to problems in the bedroom?
Well, think about the symptoms we discussed. Pain, swelling, difficulty retracting the forcing. All of these can make achieving or maintaining an erection a real challenge.
So it's like a physical barrier to intimacy.
Exactly. And then there's the psychological component. Dealing with a yeast infection can be stressful and embarrassing, which can also impact sexual performance.
So it's a double whammy. Physical discomfort A and B mental stress.
Right. It's a complex interplay of factors, and it's important to address both the physical and psychological aspects of the condition.
Now, this is where it gets really interesting, and I'm sure our listeners are wondering the same thing. If the yeast infection is treated, does that mean the erectile dysfunction goes away too?
That's the hopeful part. In many cases, yes. Treating the underlying yeast infection often resolves the erectile dysfunction as well.
So there's light at the end of the tunnel.
Absolutely. It's important for men to remember that these issues are treatable and there's no shame in seeking help.
Okay, that's reassuring to hear.
Yeah.
But I'm curious, how long do these yeast infections typically last? Is it something that clears up quickly?
With proper treatment, most yeast infections will clear up within a week or two. But here's the catch. If they keep coming back, it could signal an underlying health issue that needs further investigation.
So recurring infections are a red flag.
Yeah, it could indicate something like an immune deficiency or even undiagnosed diabetes. So if you're dealing with repeat infections, don't just shrug it off. Get checked out by a doctor to rule out any underlying health conditions.
Great advice. So we've covered symptoms, causes, treatment, and even the potential link to erectile dysfunction. But what about prevention? Are there things guys can do to lower their risk of getting these infections in the first place?
Absolutely. And a lot of it comes down to those good hygiene practices we mentioned earlier. Washing regularly, especially after sweating or exercise, drying thoroughly, and opting for loose-fitting, breathable clothing are all great ways to keep things clean and dry down there.
Sounds like simple but effective strategies. Anything else guys should keep in mind?
It's also important to be mindful of antibiotic use. Antibiotics can disrupt the natural balance of bacteria in the body, sometimes leading to a candida overgrowth.
So it's all about maintaining that delicate balance we talked about earlier.
Exactly. And of course, practicing safe sex is always a good idea to reduce the risk of irritation and infection.
Great tips. We've covered a lot of ground here today, but I want to circle back to something we touched on earlier. The importance of seeing a doctor.
You're absolutely right. It's so important to reiterate that.
And it's not just about diagnosing a yeast infection right. It's also about ruling out other potential conditions that might have similar symptoms.
That's a crucial point. If you are experiencing any unusual symptoms down there, don't try to self-diagnose. Get checked out by a healthcare professional so you can get the right treatment and peace of mind.
Couldn't have said it better myself. So we've covered symptoms, causes, treatment, and even the link to erectile dysfunction. Any final takeaways you want to leave our listeners with today?
Well, I think the main takeaway is that male yeast infections are more common than many people realize, and they shouldn't be ignored. The good news is that they're usually treatable, and taking simple preventative measures can go a long way in reducing your risks.
It's all about empowering ourselves with knowledge and taking charge of our health right.
Exactly. And remember, there's no shame in seeking help. Your health is worth it.
Well said. And on that note, I think it's time for us to wrap up this part of our deep dive into male yeast infections.
Thanks for tuning in, everyone. You know, one thing that struck me as we were preparing for this deep dive is just how much misinformation is out there about male yeast infections.
Oh, absolutely. Yeah. I mean, it's not exactly a topic that comes up at dinner parties,
Okay.
so it's understandable that there are a lot of myths and misconceptions floating around.
Exactly. And some of those misconceptions can be harmful, leading people to delay seeking treatment or even try ineffective home remedies that could actually make things worse.
Yeah, that's a good point. So let's bust some myths, shall we? What are some of the most common misconceptions you've encountered?
Well, one of the biggest ones is that yeast infections are only a problem for women. We've obviously debunked that already, but it's amusing how many people still believe it.
It's like that old saying, what you don't know can hurt you, right?
Exactly. Another common myth is that yeast infections are always sexually transmitted. While sexual activity can be a trigger, as we discussed, it's definitely not the only cause.
So you're saying a guy could get a yeast infection even if he's been living a monk-like existence?
It's possible. Remember, it's all about that delicate balance of microorganisms. Things like tight clothing, poor hygiene, certain medications. These can all disrupt that balance and create a breeding ground for candida.
So it's not necessarily a reflection of someone's lifestyle or hygiene habits.
Exactly. And speaking of hygiene, here's another myth that needs to be busted. The idea that douching or using harsh soaps will prevent yeast infections. In reality, those practices can actually make things worse by disrupting the natural pH balance of the genital area and wiping out the good bacteria that help keep candida in check.
So gentle cleansing is the way to go. No need to go overboard with the antiseptics.
Precisely. And this last myth is one that I think a lot of people are embarrassed to admit. They believe that yeast infections are a sign of being dirty or unclean.
Oh, I bet that one carries a lot of shame.
It does, and it's so unfair. Yeast infections can happen to anyone regardless of how clean they are. It's simply a matter of an overgrowth of a naturally occurring organism.
It's like blaming someone for getting a cold. It's just something that happens.
Right, exactly. Now, shifting gears a bit, I think it's important to mention that while we've been focusing on the physical symptoms and causes of male yeast infections, there can be a psychological component as well.
You mean like the emotional impact?
Yes, dealing with a yeast infection, especially a recurring one, can be stressful and embarrassing. It can lead to anxiety, relationship issues, and even depression in some cases.
So it's not just a physical health issue. It can affect mental well-being, too.
Absolutely. And that's why it's so important to have open and honest conversations about these things. The more we talk about it, the more we normalize it, and the less shame people will feel about seeking help.
I'm all for breaking down those barriers.
Yeah.
Knowledge is power, and in this case, it can be incredibly freeing.
Couldn't agree more. You know, one of the things that's really encouraging is that there's a lot of promising research happening in the field of yeast infections.
Oh, that's great news. What are some of the most exciting developments on the horizon?
Well, for one, scientists are working on developing new and more effective antifungal medications with fewer side effects. This is especially important for people who experience recurring infections or have difficulty tolerating current treatments.
So more targeted therapies that are easier on the body. That sounds promising.
Definitely. There's also a growing interest in using probiotics to prevent and treat yeast infections. Probiotics are those good bacteria that can help restore the natural balance of microorganisms in the body.
I've heard a lot about probiotics for gut health. We talking about the same thing here?
It's the same concept, but applied to different areas of the body. In the case of yeast infections, probiotics can help to crowd out the candida overgrowth and restore a healthy balance.
So it's like introducing reinforcements for the good guys to fight off the bad guys.
Exactly. And there's actually some pretty compelling research suggesting that certain strains of probiotics can be effective in preventing and treating vaginal yeast infections.
That's fascinating. What about male yeast infections? Is there any research in that area?
The research is still in its early stages, but there are some small studies that have shown promising results.
Okay, so it's definitely something to watch.
Absolutely. And it's exciting to think that we might have even more effective and natural ways to address yeast infections in the future.
It's all about giving people more options and empowering them to take control of their health. And speaking of empowerment, I think one of the most important things we can do is to encourage people to be proactive about their health.
Absolutely. It's not enough to just wait until symptoms appear. We need to be actively taking steps to prevent these infections in the first place.
So what are some key things guys can do to stay ahead of the game?
Well, we've already talked about the importance of hygiene, but it's worth repeating. Wash regularly, dry thoroughly, and avoid tight clothing.
Those are the golden rules.
Definitely. And it's also important to be mindful of your diet. Sugar can actually feed candida, so cutting back on sugary foods and drinks can be helpful.
So maybe skip that second slice of cake.
Probably a good idea. And if you're prone to yeast infections, it's a good idea to talk to your doctor about whether taking a daily probiotic supplement might be beneficial for you.
That's a great tip. And it never hurts to have that conversation with your doctor. They can help you assess your individual risk factors and recommend the best preventative measures for you.
Absolutely. It's all about working together to create a personalized health plan that works for you.
I love that approach.
Yeah.
You know, one thing that I think is often overlooked is the role of stress in our overall health.
You're so right. Stress can wreak havoc on our bodies, and it can definitely make us more susceptible to infections, including yeast infections.
So managing stress is a key piece of the puzzle.
It is, and that looks different for everyone. Some people find relief through exercise, others through meditation or yoga. It's about finding what works for you and making it a priority.
Because when we're stressed, our immune system takes a hit. And that's when those opportunistic little yeasts can start to take over.
Exactly. It's all connected.
You know, this deep dive has been incredibly informative. I feel like we've really unpacked this topic and shed light on something that's often shrouded in silence and shame.
I agree. It's been a great conversation, and I hope our listeners are feeling more empowered and informed.
Me too. And on that note, I think it's time to shift gears and wrap things up with some key takeaways.
Sounds good to me.
Okay, so we're back for the final part of our deep dive on male yeast infections. We've covered a lot of ground, but I think it's really important to distill it down to the essentials.
Yeah.
So for all you listeners out there, What are the top 3 things you want to make sure people remember about male yeast infections?
Okay, great question. Here's the trifecta. First, they are way more common than you might think, and they are nothing to be ashamed of.
No shame in the yeast game, right?
Exactly. Second, early detection and treatment are key. Don't ignore those symptoms, guys. Get checked out by a doctor so you can get the right diagnosis and treatment plan.
So true. Early intervention can make a world of difference.
And finally, remember that there are simple, practical things that you can do to prevent these infections in the first place. We talked about good hygiene, breathable clothing, being mindful of antibiotic use, and managing stress.
It's all about taking a proactive approach to your health.
Exactly. And, thinking back to all the myths that we debunk, I think it's crucial to emphasize that these infections are not a reflection of someone's cleanliness or character.
Right. It's just biology, things happen.
Exactly. So if you are experiencing any of the symptoms that we discuss, don't hesitate to reach out to a healthcare professional. They can help you get the right diagnosis, treatment, and support.
Yeah, and remember, there are resources available. You don't have to go through this alone.
Absolutely. There are doctors, websites, and even support groups that are dedicated to helping people navigate these challenges.
I love that you brought up support groups. It's so important to remember that there's a community out there and you're not alone in this.
Exactly. Sharing experiences and connecting with others who understand can be incredibly empowering.
Well said. At the end of the day, it all comes back to that sense of empowerment.
I couldn't agree more. It's about taking charge of your health, being informed, and advocating for yourself.
It's about breaking down those barriers of silence and shame and replacing them with knowledge and confidence.
Exactly, and having these open and honest conversations.
Well, this has been an incredible deep dive into male yeast infections. I feel like we've shed light on a topic that's often overlooked and misunderstood.
I agree. It's been a pleasure exploring this with you and our listeners.
I'm Ethan Reed.
And I'm Grace Morgan.
And this has been KenkoVibe. For everyone tuning in, I hope you found this deep dive informative and empowering. Remember, knowledge is power, and taking charge of your health is one of the best things you can do for yourself. We'll be back tomorrow with another deep dive into a fascinating health topic. Until then, stay curious, stay informed, and stay healthy. And don't forget to subscribe, like, comment, and share this episode with anyone you think might find it helpful. We appreciate your support.
See you all next time.